Go for it.
Okay. Thanks very much for asking me to do this. As I said, I'm very nervous with a virtual room full of peers, and you are the experts on this. Um, my name is Helen Lynn. I've been working on issues linking gender health, equity, and the environment for the last 28 years. I'm currently the environmental campaign manager with WEN, the Women's Environmental Network, where I also worked as a long time as the health coordinator. I also facilitate the Alliance for Cancer Prevention, who is part of the Pesticides collaboration, and we campaign for the recognition of the environmental and occupational risk factors for cancer. I'm also a campaigner From Pink to Prevention, working on primary prevention of breast cancer, and also worked on the Lincolnshire Cancer Project. I don't purport to be an expert on pesticides, but what I do see is how women and those born female are excluded from studies, from policy, from regulations, and from risk assessments in relation to chemicals and pesticides. And I think also that in these very turbulent and troubled war-torn times, we must acknowledge the grief and loss of so many, and remember that this will also add to the intersectional nature of this issue. I'd also like to note that we'll be discussing pesticide science and research in relation to women, girls, and impacts on the females and the female body. We aim to use inclusive language, but when we refer to research carried out exclusively on women and girls, of which there is very little anyway, we will reference it as such. And this doesn't make assumptions about others who are born female and are impacted by pesticides. And we also acknowledge the gaps in research to facilitate greater understanding of how pesticides particularly affect and impact members of the LGBTQ+, transgender non-conforming and gender non-binary communities. So why are women and those born female affected differently? Well, we start from the premise that women are not the default male, meaning that in yonder times, chemicals and pesticides were tested on male bodies and the results extrapolated to assess impacts on females. Or we also learn from studies on exposed populations or workforces. So women and those born female have a lifetime of hormonal changes. We go through puberty, pregnancy sometimes, lactating sometimes, menstruation and menopause. So there is much hormonal change which increases the specific hormonally related diseases or the risk of hormonally related diseases like breast cancer and endometriosis. We have different immune systems. There's actually differences right across every system in the body between males and females. We have thinner skin, which may allow more absorption. We detox more slowly after exposure, and we have more fat tissue, so more storage for fat-loving chemicals like endocrine disruptors and pesticides. We're also smaller than men, so this can have implications for PPE, not made for women's bodies, in our workstations, our work appliances. Menopausal women, for example, can really overheat in an inappropriate PPE, which is sometimes needed to spray pesticides. And also it's hard to remove to pee or change a menstrual pad in the field as well. There's the issue of triple jeopardy. For example, agricultural workers are exposed in the fields to pesticides. They may be spraying them or they may be working the fields. And then again in the home, if they live near sprayed fields or greenhouses. And once again in the wider environment from contaminated water. And this can be especially relevant in the global south and other countries aside from the UK. Where we also have issues about bystander spraying. And yes, men can be exposed as well, but still women occupy different occupational roles, socioeconomic roles, and we also still do more cleaning, washing and housework where we can be exposed differently. Gender affects occupational roles. Women tend to occupy different occupational roles than their male counterparts due to this socioeconomic status or where they live, for example, may be in more rural areas, where frequently women and girls are involved in subsistent agriculture or maybe unpaid family work on the farm, or they can also be employed as seasonal labourers and they often go unaccounted for. And so when we consider the many ways occupation brings women and those born female into contact with pesticides, there's a lot, really. There's a lack of recognition of the different occupational roles which expose us to pesticides, and also there's this kind of continuum, sometimes even across continents, from cradle to grave, in terms of things like food growing, harvesting, manufacturing as well, and then also cooking, where women can be unknowingly exposed to pesticides, initially through activities like weeding and harvesting. And again, this usually doesn't require PPE in the field. And it must be said that in the global south, or in countries where health and safety is completely lacking or not adhered to, the situation can be pretty grim. So exposure in the fields can translate to exposure in the workplace, like with professions like floristry, for example. And this echoes right back to flower growers, where women in Kenya growing flowers are involved in weeding, flower cutting and packaging, and they show a higher frequency of poisoning symptoms than men that do the actual spraying. Also, due to traditional gender roles, women are more exposed to pesticides through their household chores, such as washing, spraying equipment, or their husband's pesticide-soaked clothes. Also with storing pesticides or disposing or reusing sometimes of pesticide containers. And in Vietnam, for example, a study found that more girls reported exposure to pesticides from washing, spraying tanks compared to boys. Also, we have this kind of other different occupational roles that we may not think about, where women come into contact with pesticides, like flight attendants, spray pesticides in cabins, and in food canning industry, where we see elevated risk of breast cancer also found in women that work in that industry. Recently, figures on unintentional acute pesticide poisoning were estimated at 385 million, or roughly half the world's farmers and farm workers are poisoned each year. But there wasn't a gender breakdown on that, and I was going to talk more about that later. Just a little bit about pregnancy, well, quite a lot actually, because exposure, pre-birth exposure in the womb can be quite impactful when it comes to pesticides. We know that mothers, for example, with the highest level of organophosphate have greater risk of neurological effects in their children. And when I did some work in Lincolnshire, there's quite a prevalence of Ewing sarcoma there, which is quite a rare form of cancer, and that was associated with a ninefold increase if parents were employed as farmers, or a sixfold increase if there was parental exposure to pesticides in any occupation. And also children of mothers working in farming industry before conception. So again, if there is protections, they need to happen way before pregnancy even happens. But also during pregnancy, they had almost an eightfold increase of Ewing sarcoma. We also know that pre-birth exposure to pesticide is linked with neurological and developmental disorders, and also pesticide exposure also linked to increases rates of breast and ovarian cancer and endometriosis as well. Just a little bit about endocrine disruptors, but I'm sure you all know this anyway. The endocrine system is the body's messenger system, controlling every aspect of life. Endocrine disruptors, which pesticides can be endocrine disruptors as well, adversely affects reproduction, developmental disorders, including brain, fertility, breast and other cancers, obesity, asthma and allergy. And we know as well, when we look at chemicals and pesticides, that the dose no longer makes the poison. It used to be an old adage. There are no safe doses of exposure to endocrine disrupting chemicals, or sometimes pesticides as well. So we also know that from cradle to grave no longer applies. It's now from conception to grave. And we know because it's the timing of exposure in the womb that can be more important than the dose. And these exposures can predispose a fetus to breast and other cancers and diseases later in life. As well, there's issues around potency, high dose experiments don't predict low dose impacts, and we have the cocktail effect as well. When we talk about triple jeopardy in terms of being exposed in the home, the workplace, and again in the wider environment. When it comes to breast cancer, there are links between breast cancer and pesticide exposure. And again, looking at women working in the fields during or shortly after pesticide application, and among women who've ever been employed in the fruit and vegetable farming industry, there are elevated risk of breast cancer. It's also been found in female agricultural workers, and the risk increased with the duration of the employment as well. The use of several organophosphate insecticides was associated with elevated breast cancer risk among farmers' wives, which means that women do not actually need to apply the pesticides to be exposed. There was also increased risk of ovarian cancer and endometriosis. A study, the agricultural health study in Iowa and North Carolina, for example, found elevated breast cancer risk associated with husbands' use of several pesticides. And also we have issues around menopausal status, which were associated with breast cancers in studies with a wide variety of pesticides. And none of these things is ever considered in the risk assessment or for those working or using pesticides. A large part of my work now is looking at menstrual products. And when you think about the amount of products that women, girls, and people who menstruate use in a lifetime, 11,000 menstrual products in one of the most absorbent parts of the body, the vulva. Pesticides and biocides have been found in a range of products, tampons, panty liners, and some reusable pants as well, thought to be from the cotton, but sometime in connection with the biocides intentionally added to fight microbes or add odor as well, or anti-odor additives in products. Many of these have been linked to reproductive and developmental disorders, and again in a place which is very absorbent, and there's been very little study about the impacts of this. And we know, but one study suggests that irritation, for example, from contamination in period products is linked to an increased rate of sexually transmitted infections, which should and could be very relevant. When it comes to data, this is one thing as a researcher which really gets up my nose. Where we get our data, there's very insufficient data to estimate the incidence of poisonings and health effects for women. And one big reason is because of this lack of gender disaggregated data and gender perspective as well in occupational and environmental health research. For example, the UK Parliamentary Post on Pesticides, published in 2021, and this is used to inform politicians and legislators about the impacts of pesticides on health. The report managed not to once mention women or those who may be pregnant or parents or vulnerable groups. It was almost like the fetus developed in a suitcase somewhere and it was flown magically by a stork. I mean, it was just ridiculous. And this despite the reference, lots of references using studies on women as well. And I think we need to be mindful that this is the information our regulators are getting. And I'm really sorry if anyone here has been involved in the publication of this, but I think it's just dangerous. And instead of working to be inclusive around gender diversity in language, they just excluded women and gender non-binary, trans men, parents completely. The HSE as well, which provides information for those working with pesticides, very little, if any, mention of women working with pesticides on their information. And again, because I mentioned the issue around PPE and stuff, it is relevant. So they need to really, buck up their work in the 21st century. And the last thing I'm going to mention, I'm really sorry about this pan-Europe, but despite asking 50-50 males and females questions about findings of a public opinion, poll on attitudes to pesticide use in 6 member states. They didn't report the answers broken down by gender. I mean, as a researcher, this is what I look for in reports. These are useful stats to use. And we know as well that women are more likely to be concerned about the environment and impacts on health, but we have no way of reporting it. And this is a very useful report that could be even better if it was broken down by gender. I think it's true to say as well that women are generally at the forefront of campaigns around health and chemicals and pesticides. And this is because they're the ones generally expressing concern for the health of their families, but they're also caring for the families as well if they're affected by pesticide exposure. One campaigner in Argentina, and I mentioned this specifically because a lot of the contaminated cotton used in menstrual products was linked back to cotton grown in Argentina and contaminated in the fields. Sofia Gatica, she was the winner of the Goldman Prize, I think in 2012. She sadly lost her child as a result of pesticide poisoning. I think they were only 3 months old. But she organised local women to stop indiscriminate spraying of toxic agricultural chemicals in neighbouring soya fields. And they did a citizen science project going door to door. It was a first epidemiology study in their area. And they discovered the serious effects that pesticide spraying was having on families in the area. She subsequently got a municipal ordinance passed to prohibit aerial spraying at distance of 2,500 meters from residences. So the campaign was very successful and ongoing. Endelina, who is part of a collective of Women on Farms project, a group fighting for rights of female farm workers in South Africa. Again, in 2018, and I'm sure you know this, 2019, 140,000 tonnes of pesticide banned in the EU were due to health and environmental risks, were exported to EU countries and were exported by EU countries and Britain to Brazil, South Africa, Kenya, and others. The Women on Farms project is focused on 67 pesticides banned in the EU and aims to get medical reports from independent doctors to try and prove a link within health as well. The farm workers there repeatedly cited that farmers ordered them to work on the fields soon after crops were sprayed without PPE. And they also said pesticides drifting onto nearby settlements as well, and that they had to relieve themselves in sprayed fields due to lack of toilets. And this was happening in Lincolnshire in the 1960s, and it's still happening today. The United Nations Special Rapporteur on Toxics and Health Rights said after a visit to South Africa in August that the EU's export of banned pesticide reproduces long-standing racist and colonial patterns of exploitation. So again, it's something to be mindful of in our work. So what do we need to do about this? Well, as in the case of a lot of the work I do in cancer, there needs to be kind of a three-pronged approach. So there needs to be equal footing, equal funding, and equal action on treatment care, safer detection of health impacts, but also primary prevention as well. This needs to be reflected. We need to update our cancer plans and strategies, for example, and recognise the environmental and occupational risk factors. And we really need plans updated for the 21st century to deal with 21st century risk factors. There needs to be an update on spending in relation to primary prevention of cancer from 5% to 35%. And again, this needs to look at researching the impacts of chemicals and pesticides as well. We need the medical establishment to really be up to date on their training, recognizes environmental and occupational illnesses when they see them. And this is should be including pesticide poisoning, especially in areas where exposure is likely. All data needs to be collected and broken down by sex and gender, absolutely, categorically. And we really need to put the public health we need to put the public back in the public health and start from the premise that safe and healthy working and living conditions are a human right for all. And this is just my contact details if needed. So thank you very much.
Thank you so much, Helen. That was horrifying, but very interesting. So thank you so much for running through all of that.